Hi, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and try to take actions that make a better system for all of us. We're going to talk today about U.S. government investigations in the healthcare system and how all of us, you too, can help them with these investigations. But first, let me point out that down below in the description box is a link to the Healthcare Advocacy newsletter, which is the text for today's speech. And all of the actions that I describe and all the news stories and links to government web pages and analyses, they're all in there. Okay, so let's get started. There's been a lot of outcry in the public about corporations cheating the healthcare system recently. And today's article shows that the government has been listening. So for everybody who's been raising their voice and screaming about it, good job. Okay, the first one is the Federal Trade Commission, the Department of Justice, and Health and Human Services are investigating private equity in healthcare. These agencies are seeking information on transactions, including non-reportable deals that may harm patients' health, worker safety, quality of care, and affordability, and they're all working together to do it, which is great. Private equity firms and other corporations are increasingly involved in healthcare system transactions, and at times those transactions lead to maximizing the profits of the corporation or private equity firm at the expense of the quality of care. The cross-government inquiry seeks to understand how certain healthcare market transactions increase consolidation and generate profits while threatening patients' health, worker safety, quality of care, and the affordability of care for both patients and taxpayers. This inquiry will continue to scrutinize private equity roll-ups, strip and flip tactics, and other financial plays that can enrich executives but leave the American public worse off. That's a quote from the FTC chairperson. Research has shown that competition in healthcare promotes higher quality, lower cost healthcare, greater access to care, increased innovation, higher wages, better benefits for healthcare workers. All of those things by having competition. Now, we've seen recently that an anesthesia corporation has been moving into states, buying up anesthesia operations, then jacking up the price by 30%. They're under investigation by the FTC, but that's sort of one technique for doing this. Anyway, comments submitted in response to this joint request for information will inform the agency's enforcement priorities and future actions, including potential new regulations aimed at promoting and protecting competition in the healthcare marketplaces. In addition to the launch of the RFI, all three agencies are also participating. Well, I guess they did it already today. They had a large virtual meeting earlier today, and there's a link to the website that has the agenda so you can see what they were talking about. Now I want to tell you, your voice matters. So you should check out the three actions below, and if you can help, then you're helping all of us. This is your opportunity to make sure that your story is told and heard, and that the comments provided to the government don't just come from private equity firms and insurance companies. I got to tell you, one of the RFIs that I looked at had over 4,000 comments on it, and you can bet a whole bunch of those come from industry. Okay, anyway, let's get started. The CMS-DoJ HHS RFI, let me just read you what they're looking for. The agencies are requesting public comment on deals conducted by health systems, private payers, private equity funds, and other alternative asset managers that involve healthcare providers, facilities, or ancillary products or services. The RFI also requests information on transactions that would not be reported to the Justice Department or FTC for antitrust review under the Hart-Scott-Rodino Antitrust Improvements Act. All market participants, including patients, consumer advocates, doctors, nurses, healthcare providers and administrators, employers, insurers, and more, are invited to share their comments in response to the RFI. The agencies are seeking comments on a variety of transactions, including, get this, dialysis clinics, nursing homes, hospice, which is rife with fraud, primary care providers, hospitals, home health agencies, home and community-based services providers, behavioral health providers, as well as billing and collection services. It is due May 6th, 2024. Okay, that's the first one. Second one, CMS, the Center for Medicaid and Medicare Services, wants information on Medicare Advantage. And you can help. If you know of any shenanigans with Medicare Advantage plans, submit your data to the Center for Medicare and Medicaid Services recent RFI. Link is in the actions. Due date, May 29th. Another action. Federal Trade Commission and Health and Human Services have a joint RFI on drug that's prescription middlemen and prescription shortages, which has shown up recently. There's also, this RFI is issued by the FTC and HHS on how pharmaceutical middlemen groups may be contributing to drug shortages. The RFI stems from a December 2023 announcement outlining efforts by the DOJ, FTC, and HHS to lower healthcare and drug costs while promoting competition to benefit patients and healthcare workers. This one you can submit up to April 12th, 2024. And of course, all the links are going to be in the description box and in the newsletter. So summary, I'm very excited that the government agencies are working together to root out corruption and illegal activity that takes advantage of all of us as medical patients. I'm also excited that they're busy collecting data, and I strongly encourage you to add your voice. Now, my wife and I are actually rocket scientists, and one of the things we found so discouraging in the years Trump was president was the movement to remove data from the public. Government websites stopped collecting and sharing data as actively as they had before. This dumbing down of scientific and especially healthcare related data just allows people to game the system for their own gain at our expense. I welcome the government seeking our information to help them protect all of us from those who would cheat us, especially when it comes to healthcare. Okay, that's what I've got for you today. If you can take these actions, great. Down below, you can like, share, and subscribe. You can send me comments here or through at healthcareadvocacy1@gmail.com. Have a good evening.